Hi everyone, this is Dr. Mahesh, Rajashekaraiah. I am a consultant hematologist and a bone marrow transplant physician at the Sparsh Hospital Yeshwanthpur. And in Sparsh Hospital Yeshwanthpur, we have been dealing with all kind of benign as well as cancerous blood conditions, and we have also been doing bone marrow transplant. This month is very important for us and for all the patients who have been suffering from multiple myeloma, because this month we are having a World Myeloma Day. So as to say, what is multiple myeloma? Multiple myeloma, just like any other blood cancer, is one of the important blood cancers. What is blood cancer? As you are aware that most of the blood in our body is produced in a sponge-like tissue which is there inside the bone, which is called as bone marrow. And in this bone marrow, we have a blood-producing engine, and this blood-producing engine is called as a stem cell. And this stem cell gives rise to red cells, white cells, and platelets. Everybody is aware that white cells are very important for us because it protects our body against life-threatening infections. And one of those white cells is called as plasma cell. Due to unknown reasons, we don't know exactly why this happens. Usually this happens in old people, but of these days in India, a lot of young people also have been suffering from this particular cancerous condition, myeloma. And also it may be because of some chemical exposure, sometimes pesticides for the farmers. All this could be conditions which can be associated with multiple myeloma. And because of all these risk factors, what happens is this plasma cell becomes cancerous and it starts multiplying. 1 becomes 2, 2 becomes 4, 4 becomes 8, 8 becomes 16, and so on and so forth. Once this cancerous plasma cell starts multiplying, they cause problems to our body. And these problems, we can call it by an acronym called as CRABI, C-R-A-B-I. What does that mean? What does CRABI mean? C stands for high calcium levels in the body. Whenever a person has got a high calcium levels in the body, he suffers with a pain abdomen, unconsciousness, and constipation, and he gets a lot of body pains. R stands for renal failure. Whenever somebody gets a renal failure, he starts producing less urine in the body. And also what happens is he starts getting symptoms of renal failure like breathing difficulty, tiredness, his blood pressure shoots up, and all those problems can happen when the kidney stops working. The third problem is anemia. What is anemia? The problem with the low hemoglobin or the low red blood cells. And because of that, what happens is patient becomes easily tired. He has got a lot of lassitude, fatigue, generalized weakness, and also he may become short of breath. The fourth problem is B. What does B means? Bony pains, bone fractures, because these plasma cells slowly start eating away the bones. Bones become very weak, and because of the weakness in the bones, the patient starts getting severe back pain, rib pain, and all of a sudden he may land up in bone fractures, especially the vertebral fracture, that is the fracture of the backbone, and he may land up with severe paralysis of both the lower limbs. And the last one, I, stands for repeated infections. As you all are aware that in multiple myeloma, because only the bad cells are multiplying, the immunity goes really very down, and when the immunity goes really very down, the patient is prone for repeated infections, especially pneumonias and urinary tract infections. So now, how do you become aware that you might be suffering from multiple myeloma? Is because when you start developing all these symptoms, which is called as CRABI. That is the time when you got to visit a nearest physician or a hematologist or an oncologist. And what do? They start evaluating with a complete blood count. They also run a huge list of biochemistry profile. We do bone marrow test, and we run some more tests to finally say that you are having multiple myeloma. Also, based on the preliminary reports, we will be able to tell you whether your multiple myeloma is a good multiple myeloma or a bad multiple myeloma, or else to say what stage your disease is into, whether it is a low risk disease or else a high risk disease. After the initial risk stratification, we come to you, we talk about multiple myeloma, we counsel you about various treatment options which are there for the treatment of multiple myeloma. But I should ascertain you that nowadays multiple myeloma has not been a life-threatening malignancy for at least 99% of the patients, because we have got various treatment options which can potentially cure or prolong the disease in case of a multiple myeloma. So when you are diagnosed with multiple myeloma, first and foremost thing what you got to do is you got to comfort yourself. Don't go into a stage of depression being diagnosed with blood cancer, because nowadays it is almost treated like a diabetes or hypertension, because there are many good medicines for the treatment of multiple myeloma. Once you are being diagnosed with a multiple myeloma, there would be an admission period of 2 to 3 days, so as to see how your body is tolerating the initial therapy. And the initial therapy is usually in the form of a targeted therapy. Nowadays, there are many targeted therapies which are available for the treatment of multiple myeloma, which will not cause undue side effects which happens with most other chemotherapies like hair loss, soreness in the mouth, weight loss. All those things usually doesn't happen in the treatment of multiple myeloma. We have got some amazing drugs like bortezomib, lenalidomide, pomalidomide, thalidomide, daratumumab, and nowadays we have CAR T cell therapy, and also as a transplant team we do bone marrow transplant for this condition. It's called as multiple myeloma. The advantage of doing a bone marrow transplant for multiple myeloma is that for a very long period of time you will be disease free. We have seen our own patients living for more than 15 years, 20 years without having a disease relapse. So usually what happens is, in the initial part of the therapy you will receive 3 to 4 months of therapy which is given weekly, and later on once the disease comes under control you will get a bone marrow transplant done. There will be certain precautions which you have to bear while you are getting the treatment for multiple myeloma. You should always monitor yourself in a hygienic conditions. You should eat healthy food. You should eat always boiled food. You should always not go to crowded places or eat outside. Whenever you come across a patient who is having an infection, you should always keep away from that particular person. And also don't go to any crowded places like marriage halls, temples during this period of time. Otherwise, after an initial phase of therapy, most of you people will be able to continue with your routine, including the work which you used to do. And in general, multiple myeloma is such a disease that it is not going to affect your quality of life. You could still continue to do all the activities which you used to do before you were diagnosed with the multiple myeloma. And a long run prognosis of this particular disease, multiple myeloma, has been amazing in this decade because of the various advances that have happened in the field of multiple myeloma, which includes a lot of targeted therapies, CAR T cell therapy, and bone marrow